All right, I'm going to do the EzPaP checkoff. Before going in the room, I'll check over the physician's order if the hospital requires an order for the EzPaP. Also check over any contradictions or anything that maybe they have, such as any bronchospasms or anything they had in the past, just to kind of note that. Any contradictions would be any like intracranial pressure, active hemoptysis, any facial or esophageal surgery that that could I guess not be beneficial and actually harm them. And then after I kind of look through the visual orders, I can enter the room. Hello, I'm Tyler, a respiratory therapist here at the hospital. Today we're going to use an EzPaP. Have you ever used an EzPaP?
No.
All right, well, the EzPaP is this device right here. I already have it connected. Let me go wash my hands and everything, and I'll kind of tell you and show you how to use it. So I'm going to wash my hands and then put on my gloves here. All right, and let me just check your wristband here, just to make sure I have the right patient. All right, I got that. All right, so this is an EzPaP. What it is, it's just kind of some positive airway pressure that's going to come and kind of do two things. It's going to expand your lungs to, I guess, kind of prevent fluid buildup since your lungs aren't working maybe as much as since if you had surgery or something like that, or you've been immobile. And also what it's going to do is going to kind of create some back pressure to bring up secretions, because you don't want those secretions, because then they'll start building up in your lungs. All right, so I'll just sit you in the right position here. And we'll do this sitting upright, if the patient is able to. All right. And then let me just get your vitals here and listen to your breath sounds. So I'll check her heart rate, her respiration rate, maybe if there's the blood pressure. And then I can listen to her breath sounds here. Just breathe normally for me. All right. And make sure to record those. All right. So on this device here, I kind of set your goal at 20. And all you'll do is kind of take normal breaths and then blow out against it, trying to get to the 20, but you don't want to forcefully blow. You just kind of want to do a little more than an average blow into it, and hopefully you're going to hit that goal there. All right, and you can use this. You can put a nose clip on if they have troubles. If they're not maybe, I guess, actively participating, and kind of put a mask on. That might help them out, or you might have to switch to some other therapy. So I'll just have you put your lips over that and hold. And then before I turn on the flow meter here, I'm going to bleed it out. Make sure there's no particles that are going to go in or anything. So I'm just going to bleed it out. All right, make sure there's no leaks. We're all good. I'll hook it up. And I'll start at 5 liters of oxygen here. Okay. All right, now let's have you do, let's say, we'll try to go for 10 or so. So I'll just have you kind of exhale and try to get up to that mark there. All right. Try to force a little more forcefully if you can. There you go, so you're not reaching it. And if they get between 10 or 20, they're doing okay. If they are continuously getting maybe past 20, you can always turn it up to give them a little more resistance. And then just let them do the protocol of the hospital. Some hospitals, want 20 every hour. Some maybe between 10 and 20, or some, it kind of depends on the hospital protocol. So say she's did the hospital protocol, I'll place this away. Well, then I'll turn off the oxygen. And then usually after any therapy, I'll just have them do a little cough, maybe a huff cough, or kind of just a form of cough to get that secretions that were removed. All right, now I'll have you do a huff cough. Just kind of breathe in, big sigh, and then do a and get done. There we go. All right. And then after you make them do the cough, then you'll redo their list of their breath sounds again, take all their vitals, note of any sputum or anything that came up, the color and all that, and if there was any, I guess, changes in vitals that were very drastic, you'd want to stop and apply oxygen if needed. And then after that is all done, you can clean up everything, make sure the call light is back close to the patient, and then I will sit the patient back where they were in the position that they wanted to be. All right, we'll go back here. I will wash my hands, make sure everything's thrown away, and then I'll kind of let them know, I'll come back and kind of the hospital protocol. Let's say I'll come back in an hour and we'll redo the therapy. And then I'm I can exit the room and make sure I record all my before and after kind of vitals and breath sounds and everything that you did for the therapy. All right.